Good evening, everyone. Hi, I'm Dr. Rishita Shah, Senior Spine Specialist and a partner at Key Spine Clinic, holding 12 plus years of experience in dealing with spine and back pain. Today, I'm here to address all the issues that one has with back pain, primarily what to do and what not to do when you have back pain. But before we go to what to do and what not to do when you have a back pain, let's understand that why does one get back pain at the first place? A spine, which as most of y'all will know, is an S-shaped curvature and it consists of 33 different bones. The bones sit on top of each other, forming a tower which is S in shape. Between each bone, we have a jelly-like substance which is called a disc. And this sits right between the two bones. Now, this jelly-like substance that you see here becomes your load-taking structure. It is a shock-absorbing structure. So whatever activities you do, whatever postures you put your back through, your disc takes the load of it. Now, as the pressure on this goes on increasing because of, say, faulty posture, because of increased body weight or weak muscles surrounding this disc starts to deform its shape and it comes out from its original shape. That's what you see here. Now, when it starts coming out, it starts touching on the nearby structures, and that's what causes back pain. So addressing your faulty postures, addressing your muscle strength, and addressing your body weight becomes very critical in maintaining the right posture for your back. What are the main do's and don'ts when it comes to your back pain? First, what you need to do is watch out for the early symptoms and signs. Random, occasional back stiffness, difficulty in getting up from a sitting position, from the floor or from the chair, difficulty in turning in the bed. Those are all early signs of a back pain. They are the signs that come in much before the actual episode starts. So if you have any of those symptoms, please consult a spine specialist and get the accurate diagnosis. Back pain comes with pain, burning sensation, tingling, numbness. These are the symptoms that you could feel anywhere in your back, maybe in your buttocks, going down in your legs. It could go in your knee, it could go in your ankle, it could also go to the tip of your toe. If you have tingling, numbness, or any of these signs, they need to be addressed. If you are developing or feeling some weakness coming in your legs, that is a sign for a back pain or a back episode. If you are feeling that your body alignment is changing, you're drooping on one side or you're bending forward slowly or you're becoming a little crooked in shape, those are also signs of a back episode. If you have any of these signs, please visit a spine specialist at earliest and get it diagnosed. What to do if you already have a back pain? What should you do? Maintain a good posture. Okay, maintaining a good posture is very, very important. What our spine is S-shaped. It's made S-shaped so that all the load that comes on our spine is equally distributed. Now, if you don't maintain an S shape and you maintain a C shape, what happens is the pressure that we saw on the disc doubles up. So this pressure, which is there on the disc when it's an S shape, is just this much. But as soon as you put your spine into a C shape, the pressure just doubles and the disc pops out. So maintaining a good S-shaped posture is very important. There are times when we need to bend down to lift something. There are times we need to clean something which is in the bottom of the closet. Then what you must do is you have to bend from your knees and you've got to bend for a minute or two, come out of the bending position, go back. So breaking the posture is also critically important. So for the posture, it's important to maintain a good S-shaped curvature, but it's also very important to break your posture. Do not stay in a bad posture or a bent posture for longer than 20 minutes. If your job is to sit, if you require to sit anything more than 2 hours a day, you should at least be getting up every 20 minutes, even if it means that you get up, you're standing in your desk and then again sitting, that's fine, but please break your posture. So breaking posture and maintaining a good posture is very, very important. Also, sitting supported. None of us really have those strong muscles that is going to let us sit without support for hours together. So please use a back support while you are sitting. If you're sitting for a minute or two, that's fine. But if you're sitting for anything longer than 10 minutes, use a back support, whether it's the back support of your bed, whether it's the chair, or whether you're sitting on the floor, you can use a wall as a back support. So maintaining a good posture is very, very important. The third thing that you must do is have good ergonomics. Good posture and ergonomics go hand in hand. Investing into a good chair, which is going to let your back sit in an S shape, is very important. If you're gonna, you could also use something like this. This is a back roll. If you put these back roll in the small of your back, it basically, if you are like SC shape, it will help you correct your posture and help you sit erect. Most of these are available online, so you could look at those and they're worth a buy. Second most important thing for students as well as for adults who are working for more than 4 hours a day is to invest into a good ergonomic chair. A good ergonomic chair lets you follow the good posture. So that investment is worthwhile. Look at all the options available online. There are many options available over there. There are some chairs which have been verified by physiotherapists and spine specialists. I would recommend using a verified, recommended ergonomic chair. The third most important thing for your back pain becomes maintaining a good health, maintaining your physical fitness. Uh, I I understand that now because of the lockdown, our mobility is restricted, but try and get as much mobility within the house, walking within the house, climbing steps, uh, doing a doing a basic core exercises, just some form of exercise is very important, and maintaining a general health. Maintaining good health, good lifestyle prevents from any lifestyle disorders like your diabetes, your inflammatory conditions, and thereby helping you prevent a back pain. Last but not the least, what you need to do is to not ignore your back pain. Okay, if you have back pain, please address it, seek a specialist appointment, and get it diagnosed. Accurate diagnosis done on the right time is very important for you to deal with your back pain and to resolve your back pain faster without having any lifelong implications. So please do not ignore any signs, any symptoms of a back pain, or if you do have a back pain, do not try and become a Google doctor. Do not apply exercises that you see off the net. Do not apply medications. Do not have medications which your friend or your relative is having and it's worked for them. What may have worked for them will not work for you. What may have worked for them may be harmful for you. So do not do any self treatment. Seek a specialist appointment and then start your treatment. Okay, we're going to open to questions now. I already have a few questions here. My father-in-law, Divya, says that my father-in-law is having back pain for last 10 years. If you've been having back pain for the last 10 years and he cannot walk, there could be that his disc has been under tremendous pressure and because of which he is unable to. But if he can't walk, then you definitely need to seek advice. Most of the spine specialists are doing an online consultation, Divya. So you could seek some consultation appointment and they should be able to help you. We have one more question. What should I do if I get pain from getting from the bed? Okay, so if you are having pain when you get up from the bed, the first thing to do is turn to one side in the bed, then sit at the edge of the bed for a minute or two before you get up. Let the back ease up. The reason behind you getting the back pain first thing in the morning is that disc that we spoke about. This disc swells up. There's water retention that occurs in the night, and this disc swells up and becomes double in size, and which is the reason why some of us do have stiffness in the morning. So, what I would suggest is turn to one side, sit for a minute before you start walking, and try and walk backwards at least 10 to 15 steps before you start with your daily activity. That should ease up your stiffness. But if the stiffness still lasts beyond 10 minutes in the morning, then there is something that needs diagnosis over there. Uh, do our weight, we have a one more question. Do our weight have a major role regarding back pain? Yes, Mitesh. Your body weight is very critical to your back pain, because more your body weight means that your disc, your spine needs to take that X amount of more pressure and more load. So controlling your body weight, bringing your body weight down with right cardio exercises, with the app nutritional advice is very critical. Uh, Studies have shown that your body weight and back pain have a direct relation. So please work on your body weight while you work and diagnose your back pain, but do not do it without any professional advice. We also have one more question coming from someone. Do you suggest taking a short stroll when one's work requires sitting down for a long time? Yes, definitely, Khushbu. I would suggest you to get up. Say if you are on a call, you don't really need to be at the desk and look at the laptop, but you're just talking to somebody or you're going through something in your mind. Please walk a short stroll, even if that short stroll means around your desk, that you just get up, take a short stroll around your desk within your cabin, and you sit back. It is extremely helpful to do something like that. And also try and count your steps. Roughly around 5,000 to 7,000 steps a day is very good to keep yourself mobile and healthy. So a lot of apps are available on your phone, on your smart watches, that help you track your steps. So Khushbu, I would really suggest you to start tracking your steps and keep taking short strolls in between your work. This advice also goes to students who are studying, because the classes are now virtual, so they are constantly on the screen. So it's also very important for them to every 40-45 minutes to get up from their desk, walk a little bit, and sit back down. We have one more question from Mona saying, will wearing heels increase my back pain? I understand where you are coming from, but yes, if the heels are not a good quality, then they would. But primarily what you need to remember while you're wearing your heel is that the distance or the height difference between the front and the back of your heel should not be more than half an inch. So wearing platforms, wearing wedges is good, because the distance between the front of the footwear and the end of the footwear is not large. But stilettos primarily can give you back pain if you do not have the good core strength, if you do not have good calf muscles, then they definitely can give you back pain. So pick a right shoe, pick a shoe with good cushioning, and check the front and the back height should not be, the overall height of the shoe can be 4 inches, but between the front and the back should not be more than a half an inch to an inch. So wedges are to go for. Uh, what's the best way to sit to prevent the back pain? Ruhi has asked us. So the best way to sit to prevent the back pain is to sit supported. Whether you are sitting, if you're sitting, best is to sit on a chair so your entire back is supported and you're maintaining the S shape. Also using a roll in the small of your back can help you sit taller and straighter, but use the back support. Most of the times when we go on office visits and stuff, we see a lot of them sitting at the edge of the chair. Okay, so you might as well sit on a stool, right? If you want to sit at the edge of the chair. So if you're sitting on the chair, use the back support of the chair. Let your back be touching to the back support of the chair. Do not sit on it at the edge. That's one thing. If your daily activities require you to sit on the ground, which a lot of Indian household requires you to sit on the ground, please use a wall as a back support and support your back against the wall and sit. If you're sitting on the bed, use the backrest of the bed, but please sit supported. We have a question from Rahul. I have sciatic pain, L4, L5 nerve compression from the lower to toe, and my body goes cross from right to left. I am not able to stand or walk. Can you suggest what we can do? Yes, I can, Rahul. The fact that your body is malaligning, which means the disc has popped out to one side. This is what I was talking about, early symptoms for a back pain. So if your body is shifting towards one side and your body is tilting towards one side, you need to be put on right exercises which are corrective in nature, and they help you correct your alignment and bring the disc back into its position, Rahul. Um, we have a question that is there any way I can test my back muscle strength? Yes, you can test your back muscle strength. There is something called as a digital spine analysis that is available, which will specifically test your back muscle strength and will give you the value which you should be, where your muscle strength should be as compared to any other individual who doesn't have a back pain. Getting a diagnosis of your muscle strength is very important because it tells you which muscle do you need to work. It's not that the same muscle for an if an A person has back pain and a B person has back pain, it doesn't mean that both of them have the same muscle which is weak. So analyzing your muscle strength and working on the muscle which is genuinely weak is a way to faster and a better recovery, Natasha. My back pain comes and goes sometimes. Jinesh has asked us a question that his back pain comes and goes. Um, okay, so if you do have tingling in one or both the legs, tingling is a sign that the nerve is compressed. Also, we have one more question from Anju who is saying the same thing, that she has numbness in her right foot while she wakes up in the morning. So tingling and numbness, both of them are a sign that the nerve which is near the disc is getting compressed. It could get compressed because the disc is moving out, or it could be because there's some inflammation or infection around. And when there is pressure on the nerve, what happens is wherever your nerve goes, you could have a tingling or numbness over there. Tingling and numbness are the red signs which require you to get the accurate diagnosis done and do further investigations. I would suggest Anju and Jinesh, both of y'all, to seek an appointment with a spine specialist and take it forward from there. We have one more question about which is a good ergonomic chair. Back Good is a good company. Those chairs have been verified by me and my company, and we've seen very promising results with those chairs. They are very economically priced. So I would suggest in investing into a good chair. Back Good is an apt company that you could look at. They are on Amazon, and you could look at on Amazon for buying them. We have one more question. Should one do regular stretches to avoid the back pain? And apart from regular walks and Surya Namaskars, yes, you can do a couple of regular stretches. One very simple stretch. Okay, I'm just going to show you a very simple, quick stretch. All you need to do is a wall. You stand against the wall. Reduce the distance between your back and the wall. So try and flatten out your back against the wall and lift both your hands up in the air and stretch and try and reach to the ceiling. This itself works as a good distraction and a stretch on the back. So regularly doing it, periodically doing this kind of a stretch in between your work will be very helpful. Apart from that, what you could do is while you are sitting, say you're sitting, you could just curl yourself all the way down, make a C shape of yourself, and then straighten yourself and go as tall as you can, and then again curl yourself, and again you can go and straighten and tall yourself. Doing this, say 10 to 15 repetition multiple times in the day, should be very helpful, and it helps you mobilize everything from your neck to your lower back, Khushbu. Um, we have a question from Radhika, which is why do I get back pain when I wake up in the morning? As we did discuss this before, Radhika, that you do get back pain because your disc imbibes water through the whole night, so it doubles up in the size through the whole night. So when you wake up in the morning, the disc is struggling to find that extra space. Hence, you could get some back pain and stiffness. But if it is regular and consistently, if every morning you're waking up with a back pain, then I would suggest you to get opinion from a spine specialist. A physical examination may be needed. Falguni has a question for us. Is flat feet one of the reasons for back pain? Yes, research has shown that flat feet is a reason for back pain because what you mean by flat feet is that when in a foot there is a normal arch or a curvature which is normal, which helps you distribute the weight. Now if this curvature or this arch of the foot is lost and the feet become flat, what happens is it distributes your body weight inward and thereby causing a reaction upwards and causing the shock of every step that you take to go upwards, and it can impact your back pain. A solution for a back flat feet is wearing footwear which help with an arch support. You get footwear with arch support, or you can take an external arch support and you can put it. Multiple and more options are available online. You can just stick that arch support in your shoe and you're good to go. But Falguni, I must add that if you do have back flat feet, you should be wearing an arch support most of the time. But very important to wear the arch support while you are doing your walk, while you are doing your jog, or any impact activity, or if you're playing any sport, then it's very important at those times to have an arch support. We have one more question from Jinesh over here. No, from Naina. Is swimming or walking better for my back? Swimming and walking are both very good. If you do not have any knee pain, you could go for walking. But if you do have some other knee pain, some other joint pain, then swimming becomes an excellent exercise. It's a very good cardio exercise as well as it builds a good core muscle strength. So personally, I would prefer swimming for the back over walking because it gives you the good core strength also. But if swimming may not be possible every time, then walking is a second best option. Also, what you could do is add in a little bit of backward walking in your daily routine. That should definitely help you. We have a question from Rupal. When I stand for too long, my back hurts. What should you do? First thing is break your standing time. So every 10-15 minutes, try and sit down. But if that is not possible, when you are standing, try and take a support towards a chair or a stool and put one foot on the stool and you stand. So say if you're at a party or an event and it's not really possible for you, Rupal, to sit, what all you need to do is put your foot slightly up on a chair or on a little plank and just offload your weight. That should do the trick. And what you could also do is in between, just stretch open your back a little bit, and that should help you. Uh, Okay, Anju has a question that they have suggested some exercises for numbness. Will it completely resolve? Yes, if the nerve still has its conductivity, then your numbness should completely resolve. I would suggest you to do your exercises as prescribed and timely, religiously, with discipline, do them. They should resolve. Most of the times, what we have seen excellent results if there is discipline from the patient's end. We've seen excellent results coming in. Um, we have a question from Prachi. I have stomach pain and back pain, and I did sonography and blood tests, and all have come normal. Stomach pain, you could get a referred pain from the back in your stomach as well, but having a stomach pain and a back pain could and could not be related. I would suggest, Prachi, that you have a physical consultation with any spine specialist. You could either do in-clinic consultation or you could do a teleconsultation. We have one few more questions on the chair. Yes, guys, please go ahead and look at this company called as Backgood. I have personally seen their chairs and verified them, so I would strongly suggest using Backgood products. Even their laptop stand is very efficient, so you could look at their laptop stand and the chair. We have a question from Mrs. Sejpal. Why do I get pain behind my neck near the left shoulder? Getting the pain in your neck and radiating towards here is called a radiating pain. It could come from your neck. More likely, it looks like it's coming from your neck. Maybe your neck, there's some nerve over here which is getting compressed, and that's what is giving you this pain. So, doing exercises which helps you relieve the discal pressure should help you. My mom has, again, we have this questions going on. Okay, we have a question from Jennifer. Have been diagnosed with degenerative spondylitis and I'm told I cannot dance. What should I do? I'm 67-year-old Jennifer. Who said you can't dance, Jennifer? I don't see a degenerative spondylitis as a hurdle towards your dancing, but unless you have more damage than spondylitis, uh, I don't see a reason why you cannot dance. Degenerative spondylitis is just a regular process of degeneration that our bones and our body and our muscle goes through with aging. So, Jennifer, I really suggest seeking a teleconsultation, and we should be able to help you get back to your dancing, and maybe you could invite us for your dance. Um, we have a question from Supriya. Supriya is asking, will plantar fasciitis have a typical presentation of a dorsal heel pain? Yes, Supriya, plantar fasciitis has a typical symptom of heel pain, inability or extreme pain in putting your foot down on a floor after getting up. So the first few steps when you place your heel on the ground are extremely painful, and after say 2 or 3 minutes of walking, it eases up. Those are the signs of plantar fasciitis. What you need to do is you need to stretch your sole of the foot. All you need to do is sit in a cross-leg position and bring the toes towards yourself, thereby stretching the sole of your foot, and that should be helpful. We have a question from Amit saying that he has a back pain on the right side sometimes, and it's also going in his leg below, and he has taken massage and physiotherapy but no relief. Okay, so this is a very common question. Thanks, Amit, for addressing this. Most of us like I get this question a lot of times that I've done physiotherapy but it didn't work. Does physiotherapy work? Yes, it does work if you've got the right advice. Okay, there are two types of physiotherapy. One is a very passive where they just give you current or they will give you heat pack and massage. That's very passive physiotherapy that may be required only in acute cases. But when you want to address the actual cause or the actual problem, what you need is an active or accurate diagnosis, and working on the right muscles and the right structure is very important. So, Amit, I'm not sure if you've had a passive physiotherapy treatment and hence you've not had a relief, but I would suggest you to seek one of our spine specialists at Key Spine Clinic, because we believe only in active therapy. We do not follow passive therapy unless the pain is extreme. We have a question from Deepa over here, which says that uh, I have lost muscle strength in my lumbar muscles 4, 5, 6. What should I do? And can I do walking for weight loss? Yes, Deepa, you could do walking for weight loss. But along with walking, 80% of your weight loss will come from the right nutritional advice. So following good eating habits and seeking a nutritional advice should help you with your weight loss, along with a cardio exercise, which could be walking, swimming, or any of those. To address your question about loss of muscle strength, what you need to do is you need to restart building your muscle strength. do some good core exercise and build your muscle strength. I don't see a hurdle in you getting your strength back. Uh, we have 2-3 more minutes, so we're going to answer a few more questions. I have somebody saying that I have pain at my upper back whenever I stand for a few minutes. Yes, you know what you need to look at, that when you are standing, are you standing tall and straight, or are you like leaning forward and standing in this type of a posture? If you are going to be standing like this, uh, more or less everybody who stands like this is going to get a back pain. So correct your posture while you're sitting, standing. Don't stand like this. Please stand tall. And a quick trick I can give you is put your hands behind the back and stand. When you put your hands behind your back, automatically it corrects your posture and you're good. Last, we have one question that we're going to address is Mrs. Rajni Sachdeva. She's saying that she has back pain for the last 2 years and has had a compression fracture at D10, D11, but the pain is still there. Compression fractures arise out of vitamin deficiency or calcium deficiency. I hope, Mrs. Sachdeva, that you have addressed those first, that you have diagnosed your vitamin D levels as well as your calcium levels and replenish them if they are low. If that is done and you still have back pain, then it could have a mechanical component to it. So doing the right exercise under the right guidance should help you. Okay, so here we come at the end of our live session. And if you all have any more queries, any more questions, please feel free to write on our Facebook page or on our Insta page. And if you all have any suggestions for any other topic regarding your back pain that you want me to cover, please put it in the suggestion box. Thank you, guys. Thank you for tuning in. And I hope all of you all grow stronger with a stronger back. Thank you. Stay strong.